My name is Heather Wiskes. Welcome to Get Me Some Green Apothecary. We're doing our CBD series tonight, and we're going to be talking about It's All in Your Head. So we're going to be focusing on headaches. So CBD, it's all in your head. What we're talking about exactly are headaches. So what are headaches? A lot of people throw the term around, it's a headache, it's this, but what does that mean? There's several different types of headaches, and the way your brain processes that pain is completely different based on what type of headache you have. So a headache is defined technically as pain rising from the head to the upper part of the body and behind your skull up through here. For some people it's behind their eyes, behind their ears, but anything that is from your shoulders or up is defined as a headache. The pain usually originates from the tissue and structures around the skull. So people think it's in your nerve endings. It's actually not. It's that fine tissue. Have you ever cut a steak open and there's that white fascia in between? That's the tissue that's actually causing the pain in your head because it becomes inflamed between your skull, between your tendons, between your muscles, and then everything gets crushed, right? So imagine when your kids sit on your lap and you got one on this side and one on that side. After about an hour of that, everything starts to hurt. That's essentially what's causing your headaches. So it's that thin layer of tissue surrounding your bones and your muscles, your brain and your spinal cord that become inflamed, that fascia. Sometimes it's dull, sometimes it's so sharp it feels like a pick through your eye. Other times it's throbbing, it can be constant, but there's different variations and different things that cause headache pain. So how exactly do you treat a headache? First you have to determine what kind of headache you're actually having, okay? Headache pain can be classified as one of three primary types. Primary headaches, these are headaches that are not in result to another injury, okay? So it's not being caused from a concussion or an accident, or maybe you got hit in the head or you're ill. These are migraines. They're undeterminable headaches. They come on out of absolutely nowhere. They include tension headaches, cluster headaches. Most common times they're tension related. Secondary headaches are headaches caused by another condition. So this is going to be a secondary response to something else that happens to you. Your kids are screaming, now you have a headache. You got into a car accident, now you have a headache. You sit on a bus with 42 13-year-olds for 6 hours waiting for a ferry that never freaking shows up, you have a headache. Then you have a friend that has things to help your headache. Unfortunately, it wasn't vodka because that's what came to mind for me, but
right.
you know.
Which will also give you a headache.
Yeah. It can also give you a headache. And that would be a secondary headache, Eric.
Oh.
Well done, secondary. And then there's cranial headaches. These are ones that stem from your optical nerve. So that's most commonly going to be from sinus pressure that puts pressure on your optical nerve, glasses that are the wrong prescription, sunglasses. Believe it or not, anytime you put something over your eyes, it has a degree of a prescription. Anytime you're looking through a lens of any kind, it has a prescription. So everyone thinks, oh, I can just buy sunglasses at a dollar store and I'll be fine. That prescription could be enough to give you a headache, and if you wear it for 6 hours, that headache you experience every day conveniently at 3 o'clock might not be a headache at all. It could be directly related to your sunglasses. You can also get headaches like this from sleeping the wrong way. And very commonly, people who sleep on their side or their face experience more headaches than people that do not. And then there's a few superficial headaches from sleeping funny, like I stated. So that's kind of an interesting thing. Headaches, tension headaches are the most common form of a headache caused by, I don't know, stress, because that is all we experience. In today's society, people experience more stress-related activity than any other time in the human history because we constantly have input. Think about in the 50s, they didn't have cell phones, so they weren't walking around with a device. They didn't have computers, so they weren't looking at screens like we are. And when they did, it was a huge boob tube, probably the size of this entire cabinet, sitting across the room, and if they wanted the channel change, get up! Put it on channel 3, because we only had 4 channels at the time, right? Mm-hmm. So now, fast forward to today, everyone pretty much has a handheld device in their hand, whether it's a cell phone, a TV, a laptop. Our cars have computers in them. So we have a lot more stress than we've ever had. So ideally, this has grown exponentially is the word I'm looking for. So this type of headache affects women a lot more just because of our hormone imbalances than it does men. So 80% of adults suffer from them on a daily basis, and I didn't put that part in, but it's actually on a daily basis. The downfall is we've become so used to having the headaches that we no longer acknowledge that we're having them anymore. We just dismiss it and consider it a decent day if it's not a stabbing pain. But that dull that you feel where you kind of do this and you don't think much of it and then you go on, it's actually a tension headache that you're suffering from. Yeah. So it can become a chronic condition, and for most women it is. The cause of tension headaches, still unknown. I can tell you right now what it is. It's exactly what we talked about. It's that ongoing fight or flight syndrome stress that puts hormones into your body, causes those tissues to inflame, and you find yourself doing a lot of this. Okay, so it's usually a dull pain. Oftentimes it's on both sides of your head. Sometimes it feels like the back of your head coming all the way up, and it feels like a pressure. It's not a pain, it's a pressure feeling. So that's the most common. You'll see a lot. They're usually not severe. They go pretty quickly. Cluster headaches are a grouping of short, intense pain. This is my headache. I hate it. Some people get migraines. This is the one where it comes on so fast where I'm like, and I have to like stop breathing for a minute and then it's gone. And then in about 2 hours later, it'll happen again, and sometimes it'll be on this side, sometimes it'll be on this side. Other times I can't speak. He's seen me where the onset of it, I literally lose my ability to communicate with people. It's incredibly painful. The main sensory nerve in your face can be affected. This was an issue for me with cluster headaches. I got something called Bell's palsy. I don't know if you're familiar with that, but it's nerve damage to your face. And I found out later in life that it's essentially a headache in the nerve in your face that causes paralysis. So for 3 months, I couldn't move one half of my face. It was, so when people say headaches can be that severe if they're untreated, it's just your body's response trying to protect itself. So for me, I looked like the Joker. I was in high school when this happened, and it looked like someone took a razor blade and literally sliced all the way down to my chest bone, and half of my face moved like it normally would, and the other half didn't do anything. It actually sagged and drooped. So now I've got one eye that smiles bigger than the other eye because the muscles atrophied, and you can only do so much. So acupuncture, yeah, steroid injections in my face. It was horrible. So cluster headaches are awful, and they can radiate to different parts of your face and again cause like that. A lot of times people mistake them for allergies. It's actually these cluster headaches that are happening, and it's your nervous system over responding. And then cannabis has been proven to stop that. What you're seeing in the green is a link that takes you to this. I'm actually going to post the slides up on our site. We always do, and you can follow all the links with all the medical documentation backing up everything that you see here. So cannabis has been proven to stop treatment-resistant cluster headaches. For me, it's done wonders in some patients. You need to have THC and CBD to stop a headache. That's the same look everyone gives me. The reason behind that is because the receptors in your brain need both. So on this poster, which those of you that are digital can't see, but I'm going to put one on with the slides for the endocannabinoid system, but most of the receptors in your brain are CBD1 and CB2. You need a little bit of the THC to activate CB1, so your CBD2 receptors kick in and pick up the slack. So everything that we carry has a fractionated amount of THC specifically for that. When we say you need CBD, you don't need to smoke a joint like you did in college. You need just a little bit to activate the receptors. It's kind of like when you're thirsty, if someone gives you a drop of water, you're like, all of a sudden it's activated, and you're like, I'm so thirsty all of a sudden. It's that scenario. If you have a little bit, your body knows what to look for and it starts producing what it's supposed to, okay? And I'll talk a little bit more about inflammation and why that's an issue. And then last but not least, the worst headache of them all, migraines. Migraines cause severe, and I don't even need to tell you this, you already know, severe, debilitating pain on both sides, sometimes one side. They can last anywhere from hours to days. You're affected by light, you're affected by sound. Breathing can actually hurt because the flexing of the muscles in your brain affects that fascia in between. It can be painful just being alive. There's been patients of ours that literally would prefer to die than have migraines because they've been so bad. It can be caused by a lot of different things. Stress, cell phones, children, husbands, no offense. I have one too. Lack of food, alcohol. Alcohol can cause migraines if you're already prone to a migraine. Okay, so what they can do is they can having alcohol can turn a cluster headache into a migraine like that. So when people say alcohol causes headaches, no, alcohol exacerbates a headache that's already happening. So when more and more people say, well, I don't drink, it gives me a headache, those are the same people that are suffering from regular cluster headaches and they don't realize it until it gets to that point, okay? So allergies, all these different things. So if you suffer from them, you could be prescribed opioids, because a lot of doctors love the word migraine and love the word opioid. It's like, oh, cool, let's give you Vicodin.
Money.
It doesn't work. Vicodin does not work for this. If you're seeking treatment that's less invasive, that is where cannabis has been proven to reduce it, okay? So what exactly is inflammation? Inflammation is your body's response to protect itself. So we're talking about headaches, we're talking about that tissue inflaming, right? So when that fascia gets inflamed and puts pressure against your bones and muscles, it's putting tension against your nerves. Your nerves then send that signal up saying, excuse me, hurts over here, mind. That's kind of what's happening. But inflammation's a lot like a mob, right? So when you see someone doing this on the ground, then this person goes, what is he looking at? And then he stops and he does, kind of like when you see an accident on 45, everyone starts to gawk. That's kind of exactly what inflammation is. Initially, as a human being, when we see something, we want to stop and help or see what it is. We're nosy, it's our nature. Your body's the same way. You have an injury, stop, let's look at it. And then another tissue swells, another tissue. Next thing you know, you've got this inflammation response. That's your body's way of helping. The downfall is if you can't get rid of that inflammation response, it starts to cause an immune failure. And then you start dealing with an autoimmune reversal. Do you understand what I'm saying? That's where Crohn's disease comes from. That's when your immune system starts attacking itself. That can happen from headaches as well. So when we're talking about inflammation, it's truly the #1 cause for all disease and sickness, because everything that happens, your body's directly going to that inflammation response because it's its defense mechanism. You know, that's why your ass swells. When someone slaps you on the ass, you get a handprint. It's your body's response to fight and trigger back.
Sensitive skin.
Is that what you're gonna keep telling yourself? I just call it, you know, a happily married couple. So how does CBD exactly work on headaches? So CBD works by interacting with cells in both the brain and your nervous system. These molecules are called cannabinoids, and we're going back to the CB1 and CB2 receptors. So everyone asks, CBD works for a lot more than headaches. When you walked in, I'm sure you saw the banner. There's about, what are we up to now? Like 67 different ailments that CBD has been proven to help treat.
Yep.
The reason why it helps with so many different things is CBD acts like water does, okay? So when you're dehydrated, if you haven't had anything to drink for weeks and weeks, your body's gonna start to suffer. Your skin's gonna dry out, your hair is gonna get brittle, your stomach is gonna hurt, your organs are gonna start to fail. You're gonna mimic a plethora of diseases because your cells are no longer hydrated. Now, flip that over. If I find you in this state and I hand you 24 ounces of water and you chug it, you're gonna throw up because your body's like, does not know how to deal with it anymore. It's like, I don't know what to do with this. I have to give you an ounce and wait for you to digest it. And then I have to give you 4 ounces, and then I have to give you 6 until we get you to 24, which is a stable place of ounces per person to get you comfortable. Some people need more, some people need less, but if I threw it to you all at once, you'd get ill. CBD works a lot like that, but instead of on the cellular level, it's working more on your nervous and your endocrine system level. So when your nervous system and your endocrine system are dehydrated, it's going to hyper-react to situations and cause inflammation responses, right? So now all of a sudden, you were asking earlier, how does it help with sleep? How does it help with anxiety? This is how it helps. So it puts your body in a state of homeostasis again. So right now, people think, oh, well, I don't have CBD, why do I need it now? You actually are getting cannabinoids in your food. You're just not getting the levels that you would find in a raw CBD form. Cabbage has cannabinoids. Kale has cannabinoids. Spinach has cannabinoids. Chocolate has a lot of them. It's one of the higher foods, and so does mushrooms. So you actually are getting cannabinoids, you're just not getting enough to reset your system. So now all of a sudden when you start taking CBD and you said you fall asleep, but you still have this conscious state, that is, CBD is putting you in a state of homeostasis again, so your body can function. So is CBD a miracle thing? No, but what it does do is it tells your body how to treat itself all over again. It puts you in a state of balance. So is water curing cancer? No. But when you are hydrated, you are less likely to suffer from disease. Does that make sense? Mm-hmm. So it's harder for people to understand it, but that's the most layman's terms. I think of it that way. So through the relationship between cells and receptors isn't fully understood because we learn every day. Eric and I got that poster about 2 months ago. It is already out of date. They have found an additional 14 CBD receptors in our body since that was printed, and that's less than a year old. So we're constantly learning how CBD can work within inside the system. So CBD may prevent the body from metabolizing anandamide, I know it's ADA. This is a compound associated with pain regulation. So same thing, it's putting your body in homeostasis again. So CBD is also thought to limit inflammation, like we talked about, that inflammatory response in the body. That's because CBD kind of acts like the police officer saying, nothing to see here, back away, nothing to see, move it along, move it along. That's kind of what CBD does inside your body. So it doesn't, all those cells don't say, what's he doing, and create that inflammation response. So not only does it reduce inflammation, it plays a huge role in headache disorders because of the inflammation. And again, when used alongside of THC, which is why everything we have has the 0.3. I'm not saying that there's not a place for more THC, because there are some situations where 0.9 works better, but notice we're not even dealing with the full percent, and it's still activating all those receptors. So it's really important for people to understand, because I've got a lot of elderly come in here and they're like, I want to get high. You're not going to get high, but you need a little bit of something to benefit a lot from the other, okay? So it's a lot of information, I apologize. So how do you use CBD for migraines? Okay, so according to the National Cancer Institute, cannabis has been used for nearly 3,000 years as an alternative medicine. Some of these uses include management of pain, neurological symptoms, and inflammation. Interesting fact that Eric and I started learning more and more about is as they're going through the hieroglyphics. Why am I having a problem with words today? It's an issue. When they start looking at all these inside the pyramids, they're finding images of medicine men holding up a 5-stem leaf. That's how far back cannabis dates to medicine. And actually there's more and more proof in the Bible itself talking about cannabis as a form of medicine, as the God-given weed or the God-given herb or the God-given plant. So do your homework a little bit. It's a little interesting to see how long we've been using it. And
thousands of years.
Thousands and thousands. We have 3,000 written down here, but I'm sure we can probably go back further if we needed to. But there's a lot of history. People think it was legalized in the 30s. It wasn't. Pot wasn't made illegal, or marijuana wasn't made illegal until the 70s. It was up through the 30s that it was actually found in every medicine, including headache and pain medicine. And people stopped using it because of the whole propaganda with reefer madness. That's what started all that, and that's a whole different topic. But it was propaganda that made it look taboo, and then it wasn't made illegal till the 70s, and now full swing later, here we're coming back almost 50 years later and making it legal again. So currently there aren't any formal guidelines for proper dosing for CBD or anything THC related. So when people come in and they ask, what is the proper dosage for headache? I don't know. We don't know. And the reason for that is your body is different than your body. CBD, unlike prescribed medications, isn't based on age, weight, or height. It's based on how your body is metabolizing something. So I can have an 85-year-old woman come in here with arthritic back pain, and she needs 50,000 grams a month or milligrams a month. So we're gonna give her 1,000 milligram tincture because she's gonna need to take like half of it a day, literally, because she's in that much pain. But then I can have a Panther player come in here, big dude, 6'4", weighs 295 pounds, 310 pounds, with a knee problem, he needs 15 milligrams a day. So he's clearly 3 times the size as the 85-year-old, 80-pound soaking wet woman, but because of the way their bodies are metabolizing, you need different amounts. So the suggestion is always to start slow and low, okay? Now they're saying between 2.5 and 20 milligrams a day. Eric and I usually recommend between 5 and 25 milligrams a day, so we're right alongside there. So when we say to start with a small dose for a small period of time. So maybe it's 5 milligrams a day for 5 days, See if that's addressing the ailments you need. See if that's hydrating your lymphatic and your nervous system enough. If it's not, up it to 10. See where that's at. We caution you for a couple reasons. Since CBD has no negative side effects, there's no way to tell if you've overdosed on it. And since there's no technically overdose, because the word overdose means it's done something negative to your body, it went from being a positive to a negative, CBD doesn't have that effect. So I could very easily give someone 50 milligrams a day and they'll feel great, but they don't need it. It's as if I gave you 84 ounces of water. You're gonna have to pee a lot and you feel great and you're not having any of the symptoms of being dehydrated anymore, but do you really need 84 ounces or would you have been fine with 24? So we caution people all the time when they say, I'm in a lot of pain, I need more. Just because you're in pain doesn't mean you need more. It just means we need to find where your level is. And it's not the same for everybody. So if you're new to CBD, always start with a smaller dose and gradually work your way up and talk to someone that knows about it, walk you through it, because there's different delivery systems and different side effects to them. So what exactly are the side effects? There aren't many. So the overall side effects are minimal. One of the main reasons why people are accepting it over the counter, it's not addictive. CBD does not affect your factory organs that affect your breathing or your heart. So unlike alcohol, you cannot CBD yourself to death. I'm sorry, but you can try if you want to. In some people, it can promote drowsiness because there are different strains. A lot of times when people come back and say, I got nauseous or I got drowsy, they took too much. They were that person that said, oh, I'll take a 20 milligram gummy thinking it's nothing because it's only one gummy, but that 20 milligrams was much, much too strong for them. They would have been better off with 5 milligrams, okay? So when you hear things like that, it's usually because they took too much of it. Your risk of side effects may depend on what you're using it for. Vaping, for example, can cause lung irritation. So earlier you had asked me, what are the different carrier methods? The different carrier methods are vaping or smoking it, anything that you inhale. Then you've got your sublingual, those are gonna be the drops that you put in your mouth and let sit along your gum line for a few seconds before you swallow. Then you have something you eat. So you have your capsules or your soft gels, those are your swallowables, and then you have your chewables like your gummies and so forth. And then of course, last but not least is gonna be a topical. And that, I said that in the exact order that your body absorbs it. So by nature, if you smoke something or you vape something, your body is going to absorb it much, much faster because of the surface area of your lungs. It's not because you're smoking it necessarily, it's just because think of all of that is going directly into your lungs and all of the nerve endings and veins and arteries in your lungs that immediately put it into your bloodstream, so it's immediately getting delivered to what it needs. So that's gonna be your fastest and your quickest, but it's also the quickest to burn away. So when you smoke it, it hits faster, but lasts less time, right? Then comes your drops. Maybe it takes 5 to 10 minutes to start taking effect when you do a drop, and it lasts maybe 2 to 4 hours. And then maybe you swallow it, and now you're looking at 4 to 6 hours because it takes 20 minutes, up to 40 even, for it to metabolize through your system. And then it gets in, right? And then lastly, topical. Topical only goes down about 6 dermal layers. So we try to reserve topical for people that are having very acute pain, like you have tendonitis in your elbow, you have arthritis in your knee from an injury, maybe you have headaches, and you know that your muscles, it's your fascia. In your neck, your fascia is only going a couple inches deep, a couple layers deep. So putting that right on your fascia does do a huge benefit there. So that's what the topical is typically used for. Does that make sense? So will CBD get you high? No, I'm sorry, not today. It can't. Even if you took an entire bottle at once, you'll feel sun drunk. So that's why I tell people, they're like, what happens if I took too much? You'll feel like you've been out in the sun all day long. That's about the worst. You won't have a tan though, sorry. You miss out on the tan, you miss out on the sand. So CBD oils are made from marijuana. They are made from a similar plant. It doesn't have the THC or the tetrahydrocannabinol. Okay, so that's the active ingredient, the psychoactive ingredient, they say, that gives you that euphoric high feeling. Okay, so THC is the component that makes you high. There are 2 types of CBD strains available on the market, dominant and rich. And Eric can explain a little bit more about the 2 strains. We carry both. Sometimes we carry combinations of both. Honestly, the strains don't mean as much to me as how the delivery system is for your body. For some people, they're sensitive to it, but we found the combination of the two strains tend to benefit people most. So most of everything we have is a combination of both. Okay, so CBD doesn't have the psychoactive properties, but THC does. Now, the Project CBD, we have this on here because it talks really deeply about the combination of why you need a little piece of both. So, what's in your head? This is the end of it. I'm letting you know, thank you for coming. We're gonna open this up to any questions you have, because I'm sure you guys are new to the story, you probably have a few questions. We do this every third Wednesday of every month. There's a different topic every month. Next month, we're going to review a basic CBD 101 series. Brian will be hosting that. It'll be via the web, and then he'll just answer questions afterwards. So you'll actually be watching a pre-recorded version of this. And we are getting some green, Medi Plus Apothecary. So what questions do you guys have, if you have any that I can answer for you?
So I know that the dosage varies per person, but for someone like me who's looking for pain relief, mostly for headaches that could turn into migraines, what would you recommend?
How did you do on the 15 milligrams that I gave you?
On the bus?
I mean, input that day too.
Yeah, I did. I took a couple that day.
Yeah, well, you took 2 that day. I did 2. I normally take 10 milligrams on the 10s. I take 10 milligrams at 10 a.m., 10 milligrams at 10 p.m. That's my everyday keep me balanced. But there are days like that I knew I was going to need more because I had more input coming at me. So I started you on 15 milligrams.
Okay. I mean, no, it definitely helped because I didn't take any ibuprofen that day.
No.
So it definitely helped me.
And a lot of these big farm, it scares me because it causes internal inflammation that people don't realize. So I know Brian had asked you if you were an O blood type or if you have any resistance to coconut oil. A lot of people don't realize that O blood types do have sensitivity to coconut oil. Even though you can't feel it instantly, your body is inflamed from the inside. And over time, you'll start to notice that inflammation in other ways, because our bodies don't like to tell us, they encrypt everything. Your head hurts, why? It doesn't tell you. I wish we just came with a manual. Hi, this is Heather's manual. She's a bitch today because, but there isn't anything like that.
Would you say, I know you said you take it on the 10s, but do you think that it would be good to take it daily, just as along with my supplements?
Thank you guys. We're gonna cut this off and do the Q&A live, but thank you for tuning in online. We're gonna post this for you and come back again next month. Have a great night.